Nice to see everyone who's here. So today I just wanted to talk about supplements for healthy aging. And I love this topic because when you go to the supplement aisle, you start reading the labels and you see, this supplement for energy. Oh, I need that. This supplement for calming. Oh, but I need that. And this one for bones. Oh, I need that. For skin, probably that too. For this, for that. It's hard to know. Well, do I just need to take 200 things a day? Like, what do I need to take? I just like to kind of talk about supplements and maybe how I prioritize which supplements I like to choose for myself to take, and then how I kind of talk about it with my patients about how do we choose which supplements you're going to take out of all the myriad of supplements that could do, possibly good things to support your health. How do we make sure we're not taking too many supplements, but making sure we're taking supplements that could help us feel better and more vibrant as we're aging. The first thing I think about for supplements is there possibly a supplement that everybody should take? And there's really only one that I really feel like pretty much everybody needs. I've only had one patient in the whole time I've been practicing, and I graduated from med school in 2000. And I've only had one patient who wasn't deficient in vitamin D without taking it. Like pretty much everybody has to take vitamin D or they're deficient. I don't know why, but that is what I have found in my practice. So that's a universal. I really feel like everybody is going to need to take vitamin D. How much you take, that was very specific to individuals as a person. So if someone needs to take a higher dose of vitamin D, which would be like 5,000 international units, it does need to be mixed with vitamin K. Otherwise, there can be kind of an exchange in the bones where the vitamin D is going in, but the vitamin K is coming out. If you're doing a lower dose, like 1,000 units or 2,000 units, it's not as necessary, especially if you eat a lot of dark leafy greens, which have a lot of vitamin K in them. But at the 5,000 or more level of vitamin D, then I like it with K. That's why Akasha makes their D5000. They put K in it just so you don't have to think about that. So that's kind of the only universal. Then let's talk about some other very, very common supplements that I feel can be really important. For people who eat a very vegetable forward diet, either a vegetarian or a vegan, it can be hard to get enough iron in your diet. Of course, there are many vegetarian and vegan foods that have iron, but it can be difficult to get enough. It's harder to absorb the heme or the iron from vegetables, especially if you're not having vitamin C at the same time, like in the form of, say, lemon juice. In order to absorb the heme out of dark leafy greens, there needs to be vitamin C as a cofactor. So when they're prepared with lemon juice, like in the salad dressing or squeezed over the sautéed vegetables, you'll get more iron out of them. So iron can be really, especially for women when they're still menstruating. When you're menstruating, every time you bleed, you're losing iron. So it's really important to make sure you're repleting your iron even more so during your period. And even after you stop having periods, it's really important to have enough iron for your red blood cells to carry oxygen. So the only way a red blood cell can carry oxygen to your brain and to your muscles and to all of the rest of your body is by having a molecule of iron attached to it. So iron is an important supplement for some people. Other people get plenty in their diet. And the only way to really check that is with blood work. So that would be part of an annual blood panel where you'd always want to just see where your iron's at, because your diet kind of may change from year to year. So it's good to just check in on that and see, do I need iron or am I getting enough in my food? Another supplement that a lot of people will need, many people, is vitamin B12. So especially if you have a very vegetable forward diet, vegetarian or vegan, it's hard to get enough B12 without a supplement. This is because B12 is for the most part in animal foods. And even people who are omnivores, like myself, I eat a little bit of everything, it's still hard to get enough B12, especially if you're the type of person like myself. I do have a genetic variant in a gene called MTHFR, which just has to do with whether the B12 that I'm getting from my foods is being turned into the active form that my body can use, which is methyl B12 or methylcobalamin. I do take a vitamin that has methylcobalamin in it, and that way I don't have to worry about it. Going along with that is also methylfolate. I do find, at least in blood work, it's very rare for me to find someone who's deficient in folate because I do have a pretty healthy practice. People eat a lot of vegetables and dark leafy greens, and that's where you're going to get a lot of your folate. But it is often good to supplement it, at the same time you're doing the B12. So the methylfolate and the methyl B12 often go together. It's in most multivitamins, but you do kind of want to check. So if you're going to choose a multivitamin, I would recommend finding one with methyl B12 and methylfolate rather than the other types of B12 like cyano B12, also called cyanocobalamin, or the other forms of folate, just in case you're one of those people who have a variant in your MTHFR gene and you're not putting all the methyl groups on. You can just take it already methylated and not worry about it. You can always check that gene with your doctor if you're curious about it, or you can just take a vitamin that has it that way. The Akasha multi vitamin, there's methyl B12, methylfolate in there, and all the, kind of a catch-all. So a multivitamin is useful as a catch-all of kind of getting a lot of the top recommended vitamins and minerals that you might not be getting in your diet that day. Another important supplement that we need to talk about is calcium. There's a lot of kind of controversy about calcium, trying to balance keeping bones strong with also not contributing to atherosclerosis or calcium plaques in the coronary arteries. One thing we need to know is that for women, osteoporosis or bones getting fragile and being prone to fracture, it's a huge aspect of morbidity and mortality. It can really affect someone's quality of life and their longevity if you don't address osteoporosis. That being said, half of Americans die of, cardiovascular disease. So you also don't want to be contributing to atherosclerosis. In my opinion, it's really ideal if you can get 1,000 milligrams of calcium in your food a day. So 1,000 to 1,200 milligrams of calcium in your food a day. But a lot of us, myself included, we just don't. And the way I know that I don't is that the International Osteoporosis Foundation has this free calcium calculator on the computer. You can just Google it. It's IOF something, calciumcalculator.com. And you put in, it has like a checklist of like 100 foods, and you put in what you typically eat in a week, and it does a whole bunch of math, and it tells you about how many milligrams you get in a day. And your goal is like 1,000 milligrams, say. If it says anywhere kind of close to that, then you're probably getting 1,000 milligrams and you're good and you don't need a supplement. Because you don't want to take too much calcium so that there's extra unused, unneeded calcium floating around in your bloodstream. But you also don't want your bones, which are undergoing constant osteoclastic breakdown and hopefully osteoblastic building up, you don't want them to not have that building block when they're trying to build up. So if it says you have nowhere near 1,000 milligrams, you do need to supplement calcium. You've got to have the building block available for your bones to stay strong. So really important for preventing osteoporosis, along with weight-bearing exercise 3 times a week. Let's talk about a few other supplements that are pretty common that people might find very useful. One would be fiber. So ideally, you're getting enough fiber in your diet. So fiber is in vegetables, fruits, beans, whole grains like quinoa. Many people do get enough fiber in their diet, and I do. I get enough fiber in my diet. I don't have to take a fiber supplement, but a lot of people don't. And typically you'll know that because you won't have a regular, easy to pass, well-formed stool, every day. So if you're prone to a lot of constipation or you're prone to a lot of diarrhea, for either one of those, you might need more fiber. So fiber has 2 types. There's soluble and insoluble. And the soluble fiber, it draws water in and helps keep the food mass in the intestines from getting hard. And then insoluble, it helps the peristalsis, or it helps the movement of food through your intestines. So those are 2 really important types of fiber that you can get in your diet, but if you're having gut problems, you might need to supplement that. There's also a phenomenon that some people have who have kind of chronic gut issues called leaky gut. And if you have leaky gut, then on a microscopic level, the intestinal lining can have some little gaps in it. And so to help smooth that over, ideally you're doing most of that with food, and you can talk to your doctor and your nutritionist about what foods you should be eating. But there's also a supplement that helps to kind of heal that intestinal lining, that's based on botanicals. It's called GI Align, and Akasha has it. It's a little powder, and you only need a little tiny bit because it's pretty impactful. So you just put a little tiny bit, like I'm talking a teaspoon, in a glass of water and drink it away from food. So that can be helpful for some people. Some people also need probiotics. So what is a probiotic? A probiotic is healthy bacteria that's living and encapsulated. And the idea would be to get some healthy bacteria into your large intestinal microbiome. So our microbiome in our large intestine controls a lot of aspects about our health. It helps our immune system and our brain health, and all sorts of kind of body processes depend on a healthy gut microbiome. So you may not need to take a probiotic. I don't, like, I'm like totally bragging on my like gut health, but like I have a stellar gut health. But many people do need a probiotic, and it's a nice, easy thing to take to help promote your gut health.
In regards to fiber, you mentioned the two different types of fiber, insoluble and soluble. Do you have to take both? Should we have those two types daily?
You'll get both types daily with a healthy diet.
Okay.
So like soluble fibers, any sort of fruit or vegetable where like if you put it in water, it would get slightly gelatinous. So like, like an apple, if you can think of like kind of cooking an apple, it kind of gets like kind of gelatinous. And then like insoluble fibers, like the hull of a bean, say, or the hull of a nut. Let's see. Okay, so cholesterol is a really common issue for people because so many of us, myself included, we have a genetic predisposition to having elevated cholesterol. It's super common. So even, you eat a low cholesterol diet, you avoid trans fats and saturated fats, you could still have elevated cholesterol. If it's just a little bit elevated, like you don't yet need to take a statin or medication to lower your LDL cholesterol, but it's not perfect, and you want to kind of protect yourself. One thing that I do recommend is something called coenzyme Q10. So CoQ10 just is an antioxidant. So it prevents the oxidation of LDL. And it also increases intracellular energy. If you do need a statin at some point, if your LDL raises to a certain level and your profile is such that your HDL isn't counterbalancing it, if you're on a statin, you definitely want to also take CoQ10. So statins kind of deplete your intracellular space of CoQ10, and so you can help support that by taking extra CoQ10. In fact, some statins are already packaged with CoQ10, like combined with them, but it's, I think, a lot more common to just take them separately. Then there's also fish oil. So fish oil is somewhat controversial just because some studies have shown that it helps and other studies have shown it doesn't help as far as preventing cardiovascular disease. And other studies have said, oh, well, you can just get it by eating your fatty fish. So salmon, sardines, those are super healthy, high omega-3 fatty acid fish. But if you're like me and you don't eat those things enough, then it can be really useful just to supplement. We do know that fish oil is anti-inflammatory. It can help with cardiovascular wellness. It can help with joint wellness. It's just a really healthy omega-3 fatty acid that lots of us don't get enough of in our diet. Let's talk about inflammation. So there's a lot you can do with your diet to lower your inflammation, like not eating a lot of sugar, not eating refined carbohydrates, avoiding super processed foods. But there are also supplements that you can take that can help. So if you're having especially focal inflammation, so for example, you're having knee pain when you play tennis, you could take an anti-inflammatory herb called curcumin, which is the active phytosome of turmeric. And there's been studies that show that it's as effective as ibuprofen for for like osteoarthritic knee pain. So it's a good thing you can take. You don't have to take it every day. You can take it as needed. It's a great thing to have on hand. We also have at Akasha a whole bunch of anti-inflammatory herbs that are packaged together. So if you really want to get a good push of anti-inflammatory effect, you can use this inflaregulator. But what you do need to know about it, the inflaregulator, it's got several anti-inflammatory herbs. So it's got the curcumin, but it's also got other anti-inflammatory herbs. And one of them is called white willow bark. And it's so similar to an NSAID, like an ibuprofen or an aspirin, that if you're not able to take aspirin or ibuprofen, you don't want to take it either. Like it has a lot of the same qualities. But so that can be very, very useful. So if you like to participate in sports, but you sometimes feel a little creaky, a little sore, it can really help. Another thing that a lot of us can use when we're aging, just to help support joints and skin and just amino acid intake, is collagen powder. So I definitely poo-pooed the idea of collagen powder when it first became a fad, thinking, well, I get it, if you're a vegan or vegetarian, you probably need extra collagen. But if you're eating animal products on a daily, you're getting collagen, like in your diet, right? But then I decided to try collagen powder in my coffee every morning, just to add amino acids so that I would be getting some protein in the form of collagen powder along with my coffee, because I don't like to eat until later. I don't like to eat when I'm not hungry, and I'm not hungry in the morning. But I do like to exercise in the morning. So I thought, well, let me just try and see if I notice any difference. And after a month, I noticed that my knees felt less creaky, like exercising. So I definitely noticed a difference in my joints. I don't think it's something that every single person needs. I'd say it's worth a try. Why don't you try it, see if you like it? I've tried the bovine or cow-based collagen. I've tried the seafood-based collagen. I find that the cow-based one disappears better in my coffee, so that one works for me. I've actually switched to one that also has nicotinamide riboside in it, also called NR. That way I just get both things all at once in one scoop, and it's just easy for me. So what nicotinamide riboside is it helps support healthy mitochondria. So as we age, our mitochondria, which is a little organelle inside all of our cells, that is the energy producer for the cell. And as we age, our mitochondria become a little bit less, I don't want to say active, but they're just not as good at creating energy for us as when we're younger. So one thing you can do to help support your mitochondrial function is by giving yourself the precursor to NAD+. Or, of course, you can get an NAD+, IV infusion. But if you just want to do it orally, you want to do a precursor to that. And then your body has the building blocks to make more NAD+ to support the mitochondrial energy production. So nicotinamide riboside, or NR, can be useful, I think, for just increasing energy, especially, athletic related energy. Okay, let's talk about hormone support. So hormone support is definitely 100% individualized for each person. There's really not an across the board recommendation that I can make. So everybody's different. It's something you should talk to your doctor about. Hormones do act on pretty much every cell in our body. And so it's an important thing to talk to your doctor about. One of our products at Akasha is called Fem Balance. It has a lot of uses. It's something you may want to, consider talking to your doctor about, but it also does have a lot of ingredients, and each of the individual ingredients can be useful on their own as well. Hormone support can be done at a supplemental level, especially if someone's not ready to take actual hormones, but that's something you should talk to your doctor about. Let's talk about mood. So supporting our mood. So sometimes we go through phases where our mood feels a little down, or our mood might feel a little uptight, or feeling super stressed. There are some supplements that can be really useful for mood. And these are supplements that you don't have to take every day. So they can be really useful. One is called L-theanine, and it is calming. So if you're going through a stressful time in life from something going on in your life, L-theanine can be really useful, and it's not sedating. So you can take it during the day, you can take it in the morning, and it's very safe. So there's doses for kids, there's doses for dogs. L-theanine is a really safe way to help support your stress management. For kind of a down mood or a little bit, a hint of anxiety, then supporting your production of serotonin can be done with like 5-HTP. But that's something you'd want to talk to your doctor about, just because it does kind of probably increase your neurotransmitter production. So it's something you want to, instead of maybe steering that ship on your own, talk to your doctor about it. There's another mood support called rhodiola, which is just kind of like a pepper upper. It's supposed to support like a happy mood. Of course, there is no such thing as like a happy pill, but it's not a super strong supplement, but it can be, useful as an adjunct here and there. I also just wanted to touch on real quick healthy blood sugar control. So we really want to keep our blood sugar under good control as we age, because sugar is super inflammatory for us. When our sugar stays too high too long, it can hurt our little tiny blood vessels and different parts of our health. One thing that you can do that's free, and everybody should do this at some point in their life, do a 3-week sugar detox. And it's just take 3 weeks and eliminate all the sugar from your diet for that little period of time. And it's super hard, but it's only 3 weeks. You can do anything for 3 weeks, and it'll change the way you eat. It'll change your taste buds on your tongue. You'll actually sense sweetness better afterwards. After you do that, you may stop drinking sweetened beverages. Like I used to add organic sugar to my coffee, and then after I did that 3-week sugar detox, I no longer like sugar in my coffee. Like I already tastes exactly the way I want it, and I do not like adding sugar. So not drinking sugar is a great way to lower your sugar intake. Getting to know what the glycemic index is really helpful. So glycemic index is just what impact on your blood sugar will each food make. And so you can look that up online. You can just Google the glycemic index of any food you're interested in. And you want to try to stay at the lower glycemic index foods. Walking for 10 minutes after a meal. So that will significantly reduce the blood sugar impact of the meal. And then insulin is a hormone that comes from your pancreas that helps put the sugar out of your bloodstream and into your cells. And you can help support that with a few different things. One is with a meal, take a pill filled with cinnamon. So it's pretty a natural way to do things. So we actually have it made, for us too. So cinnamon just helps support insulin's action on the blood sugar level. It helps push the blood sugar out of the bloodstream and into the cells. And then there's also a supplement called chromium picolinate that can also help with a little bit of insulin resistance. So sometimes the cells have a hard time accepting the sugar inside them because they're resistant to the action of insulin, and it can help support that. So that's kind of like my overview. Does anybody have any questions?
Yes, I do.
Leona?
Yeah. I'm wondering if I know about the sugar. Does honey fall into that same category, or like especially a raw honey, which I like to use in drinks? Not very much, but is that
So
on
honey
the
has
same? Yeah.
no, I honestly feel like the benefits you'll get from honey outweigh the blood sugar impact of it unless you're pre-diabetic. So because
Oh,
honey it's antibacterial, it's antifungal, it's antiviral. Like honey has all of those abilities. It also can promote your immune system, especially if you're, certain types of honey. So if you like a little teaspoon of honey in your tea or your coffee and you like it better that way and you don't have pre-diabetes, then I wouldn't have you stop.
Following on
Yes?
kind of something similar to that question, because I also need to keep an eye on my blood sugar because I have diabetes in my family a lot. I've been told that if you eat a protein or something that is not sugar first, it actually prevents the glucose spike. And then it's maybe if I eat something, for example, before getting my coffee with a spoon of honey, does that make it better?
It can make a difference. So if you have fat or protein at the same time you have carbohydrates, it can decrease the blood sugar impact of that carbohydrate. Also, when you look, if you're going to eat a food that actually has a little like nutrition label, you can look and see how much fiber is in it, because you can subtract, for every gram of fiber, you can subtract a gram of sugar, as far as fiber balances out or cancels out sugar in an equal amount. So if it says, say it's got 20 grams of sugar but 10 of them, 10 grams of fiber, then you're really only getting 10 grams of sugar, even if you had the full serving. Typically, like one carb serving is 15 grams.
So if, for example, I have a few nuts before I have something sugary, it minimizes the effect.
It can help for sure. Or like, let's just say you have this amazing crusty French bread and you really want to have a thin slice. Well, instead of just putting jam on it, put peanut butter, because then you're getting fat and you're getting protein. It's going to have a little bit different impact. And then go walk around the block. and then you're, doing a good job of kind of balancing everything out.
Oh, okay. Now I forgot what I was going to ask. Oh, iron. I'm now 87, and it's like I've heard different stories about not needing as much iron as we age, things like that. What's your take on iron with older women?
It all depends on what your blood panel shows. So your blood panel will like, you could check an iron level, and then you check a ferritin level, which is stored iron, and then a CBC, which is like your red blood cells, your hemoglobin and hematocrit, and then the size and shapes of those red blood cells. So if everything is looking great, then you don't supplement iron.
Thank
Sure.
you, Leona. Dr. Boston, let me just quickly read a message from Dr. DeMello. For those with MTHRF, Akasha has a well-researched methylated B12 complex called methylation support. Take 2 to 3, depending on your levels. I think that's follow-up from your previous discussion on the methylation B.
I have a question from Tom. He's asking, what are some of the most researched supplements for extending lifespan?
Honestly, the most important thing for extending your lifespan is to be fit and trim. So this is coming from a very well-respected cardiologist, Dr. Ilan Kadan. And so the studies have shown that as far as preventing the top 2 causes of death in the United States, which are cardiovascular disease, which is heart attacks and strokes, and the number 2 is cancer. So the top 2 things for this is to be cardiovascularly fit, like not carrying a lot of extra weight. And that doesn't mean being crazy thin. You don't need to be crazy thin. You just need to be strong and have, good muscle mass. And then you do want to be lean to where your lean muscle mass is, more than your lipid mass, just because that's how your bones stay strong. That's how you're able to kind of not tax your vascular system. So those are more important than any supplement. And there's really no magic anti-aging pill. And taking too many supplements is not a good idea. And you know this because when you've ever had a surgery, your surgeon says, you got to stop all your supplements 2 weeks or 1 week before your surgery. So you'd be thinking, well, if I'm trying to heal properly from surgery, shouldn't I be taking all these supplements? Like, wait a second, like if I'm not supposed to take these supplements before surgery in order to, heal properly from this kind of stressful surgical event, let's try to figure this out. Also, taking too many supplements is really hard on your liver and your kidneys. So the great thing is to try to just support the areas of your health that need supporting without over supplementing. Because if there's any, chemicals or compounds or supplements or, healthy herbs, if you're taking more than what your body can use, you're going to need to excrete it. And that's going to be either your liver helping you excrete it in your stool, or your kidneys helping you excrete it in your urine. So it's kind of a balance. It's a dance trying to make sure your bones stay strong and your joints stay well oiled and your brain stays bright, and but you don't want to over supplement.
Thank you, Dr. Boston. We have a question from Rachel. What are ways to lower iron if blood work shows elevated?
That is something you should talk to your doctor about, because if your iron is elevated and it's not coming from a supplement and it's not coming from food, you may have like a little biochemical difference, that has to do with your liver, where your body holds on to iron longer, hematochromatosis. There's other iron storage kind of differences that some people can have. So there's not really a supplement that chelates iron out that I would use unless it was like under the guidance of a hematologist. You can easily, though, if maybe you're eating too much iron, you can change your diet, eat a more plant-based diet that has less iron in it. A lot of plants have iron, but like we talked about, it's less bioavailable than animal iron. And if you're taking a supplement and your iron's too high, then obviously you want to stop the supplement.
Okay, Dr. Boston, I have a question from Isabella. She says, how important is it to consult with your healthcare provider before starting any new supplements?
Supplements are sold over the counter. You can go to CVS and pick up a supplement. I do think it's important at your annual visit to tell your doctor every single supplement you're taking, even if you don't take them every day. And the best thing is just like write them all down in a list, something that your doctor can just scan into your chart, or take a picture of them, that they can scan into your chart. It's always a good idea to check in, but obviously you can just go and buy it over the counter. That being said, there's lots of things that if you take too much of them, even though they're sold over the counter, it can still kill you. So like Tylenol. But I'd say if it's like a multivitamin or just a vitamin C supplement that you just want to take, just to boost your immune system because you're about to get on an airplane or something like that, your doctor doesn't really need to have a whole full appointment with you about that. But at your annual, you should say, if you're taking a multivitamin and which one, because they're all different preparations. They have different ingredients. So they need to know which one. And then any other supplements, it's good to know what they are and also what the milligram amount is. If you're unsure about a supplement, err on the side of safety and ask your doctor.
I have a really good one. Hold on. How can someone determine the right dosage for the supplements that they need?
So you can be guided by your doctor or your nutritionist or dietitian. They can help you kind of figure out what would be a good dose for you. There's also, for something like, say, vitamin D or B12, where we actually measure it, through your blood work, we can recheck it and make sure it's being repleted. So we would want to give you, if you were deficient, say, and you were the type of person who didn't want to wait until your next annual appointment to see whether you repleted your vitamin D deficiency, you wanted to check and see if you repleted it, you'd want to wait like 3 months before you recheck it, and give your body a chance to like fully replete it. And then if you're a little bit more nervous about, your levels, of course you can check it, as much as you and your doctor want to, but generally unnecessary. There's also a way to check a whole panel of vitamins and minerals. We do it not that infrequently at Akasha. It's a vitamin and mineral blood panel. So even though every year we check some of the major ones, like vitamin D and B12, folate, magnesium, there are some lesser checked ones through blood work that can be checked with like a specialized panel for vitamins.
Sorry, I had one more question. Also the purity of supplements versus buying things off the internet versus buying things from the store. What's the benefits of that?
So that's a really good question. So because supplements aren't regulated to the same level as prescription medications, it's really important to know the quality of your supplement. So you want to only buy supplements from companies that undergo third-party checks. So that means a third party not owned by the supplement company will randomly check the capsules to make sure what's in it is what they say it is. So if it says it's 100 milligrams of vitamin C, they're going to make sure that that's what's in there. So a lot of supplement companies do have this kind of higher level checking, and they may be a tiny bit more expensive than maybe some of the mass made ones, but it's definitely worth it because you want to know what you're getting, what you're putting in your body. A capsule is like a concentrated way to get some sort of nutrient. So you just want to make sure you know what you're getting and you're not getting anything you don't want to get.
Thank you, Dr. Boston. I think you may have mentioned also something about vitamin C and vitamin E. Do they contribute to longevity as well? Vitamin C and vitamin E, what are their contributions again?
Vitamin C is really important. You get it in a lot of foods, so it's not hard to get. But it's also a good vitamin to boost because it's a cofactor for collagen synthesis. So as we might get little micro tears in, say, our rotator cuff tendon or in our knees, our body is just going to heal that up. Like we're kind of always undergoing a little bit of kind of micro strain and then healing. And our human bodies are so good at doing that. But a cofactor for collagen synthesis is vitamin C. So you want to make sure you have enough vitamin C. A lot of people get enough in their diet, but it also is a pretty safe vitamin to supplement. If you take too much, you're going to get diarrhea, so you don't want to do that. But another thing that it's a cofactor for, like I mentioned earlier, is just making it so that you can absorb plant-based heme. So it's a good idea to have some sort of vitamin C, whether it's lemon juice or whether you just like take a vitamin C gummy right before you eat your dark leafy greens. Whatever form of vitamin C you like. I always keep. I'm a gummy bear person. I love gummy bears, and so I do on my counter. I do keep a few healthy organic gummy vitamins that I can like pop at night as like a treat for myself, where I'm also getting vitamins. So I have the little organic vitamin C, little orange slices. And I also have this one that's a combination of vitamin D and B12, which is on top of what I'm getting. Like I do take those in a more proper dose, but I just feel like I can always use just a little bit more of those. And it's also a delicious gummy. It's this Mary Ruth Organics gummies. So there's no artificial colors, there's no artificial flavors. There is sugar, but I'm fortunate that I'm okay with sugar, especially if it's like my dessert. It's a pretty benign one.
Can I ask what I hear a lot about raw apple cider vinegar? What do you think about that?
I'm not convinced. I guess I'll just say that. I am not convinced we need raw apple cider vinegar. Don't think like it's going to hurt you if you really like doing that and you have a morning ritual where you like to have some, but I'm not convinced you need it.
I have another question from Daniel. He would like for you to explain the benefits of omega-3 fatty acids for longevity.
So I think, like I mentioned, omega-3 fatty acids, they've been studied extensively. And there was like a fervor about them because one big study found that they improved cardiovascular risk. So your risk of having a heart attack or a stroke. But then some follow-up studies show that it didn't make a difference. And then, they can be kind of expensive. And also there's a worry of like, are they being sourced from mercury-laden fish? There kind of has been a little bit of back and forth about it. One thing we do know is that omega-3 fatty acids are really good for us, really good for our blood vessel health and our joint health. And Probably ideally we could get it all in our diet. If we had a super Mediterranean diet and we were eating fresh caught salmon all the time and we loved sardines, out of the can. I wish I did. Flax seeds, they're really high in omega-3 fatty acids. It'd be probably ideal to get it in your diet. It helps with like the health of your blood vessels so they're not getting too stiff. It decreases inflammation. Pregnant women have to take it, to make sure their newborns have a healthy neurological system. So there is definitely health benefits from it. Even though I think some of the research has been controversial as far as like how necessary it is as far as, preventing cardiovascular disease. But I think it's a good idea, especially if you aren't getting a lot of that in your diet.
Yeah, I've noticed with the omega-3s and or fatty acids, I read that they're actually two separate things. And if you get something that says fatty acids, it doesn't necessarily mean omega-3s and vice versa. Could you straighten me out on that?
Yeah, so that's a good question. So there's a lot of different fatty acids, and the most healthy ones are omega-3 fatty acids, the EPA and DHA. Okay, so there's also omega-6 fatty acids, which you do need in your diet, but they're not as healthy. Like you want a ratio of your omega-3s and your omega-6s to be higher with the omega-3s. So the best thing is like when you're looking at the supplement, just look at the label just for the EPA and DHA and don't worry about the others. Like just go for that.
What are some of the most emerging trends right now that you're seeing for supplements?
I'd say one of the hot new things is supporting mitochondrial health. So that NR that I talked about, the nicotinamide riboside, that is a hot ticket right now. There's a lot of, influencers and, anti-aging athletes and a lot of people talking about it, a lot of people really excited about it, and a lot of people offer the IVs, and we do. There's enough research on it that we feel comfortable doing that at the Akasha Center. I think that the research is new-ish, and so it's hard to say. Like I wouldn't say across the board we all need to be taking NR to boost our NAD+, but I don't think it can hurt you like at the normal levels that you would take as a supplement. So I do think it's a good idea to try. Like I just have it in my coffee every day. So I think it's probably worthwhile, especially if you're, exercising on a regular basis, just to support that intracellular energy. Some of the other trends, well, I say collagen powder is a huge trend. Like now you go to the grocery and there's like a whole section of collagen powders. Like that's kind of new compared to 10 years ago. And I do actually, like I said, I totally poo-pooed it. And now I actually think there's a use for it because I saw it in myself. I do think a protein powder is really helpful as we age because it's really important to get enough protein in our diet. And it's just so hard. It's so hard to get enough protein in our diet. So that's just a really easy way to support protein is with a protein powder. You want to make sure it's organic and, hopefully it's like pea plant protein based. It doesn't have to be pea plant protein, but it's like should be plant based, I'd say. I think the one at the Akasha Center is pea plant protein based. So I love legumes and beans as like our healthiest foods that we can eat. And if I think about it, I'm like, well, if you plant a pea or a bean, like it becomes a whole new plant. Like of course those are the healthy foods. I'm trying to think, what are some of the other fads that are really hot right now?
Phosphatidylcholine, Dr. Boston. Hi, Dr. Boston.
Hi, Dr. DeMello. So I
Hello,
don't know
dear.
as much about it. Dr. DeMello wrote a whole thing for us about it. It does sound amazing, but I actually don't know enough about it to like speak on it. Do you want to just say a little bit about it?
Yeah, if you don't mind. So
That'd be great.
choline is one of those very important elements for our cognition. It's part of our brain health. Phosphatidylcholine is a supplement, an IV supplement that we started using after the COVID pandemic was really causing a lot of cognitive effects or side effects on a lot of our patients. And many patients with long COVID really couldn't remember a lot about what they needed to remember. Their cognition was really decreased. They felt very tired. They felt that they couldn't connect the dots. And we know that the brain is affected by COVID, especially long COVID. So we started doing this research on phosphatidylcholine, also referred to as PC, and the research out there was astounding. It's actually choline is part of the medications that people use for Alzheimer's and for other cognitive deficits. So this is the pure form. It's not something that it's created in a pill form or that it's very high in its delivery system. But what we know is that by giving a small amount of it to our patients, especially combined with glutathione, that we're really helping their brain health become optimal. We are increasing what we refer to in neurology as the firing of your synapses. And this is what we need, what the brain does in order to connect the dots, in order for us to go from one thinking pattern, from one thought to another. We need to fire those neurons. And PC, or phosphatidylcholine, has really been shown to increase the firing by promoting better brain, what we refer to as brain metabolism, metabolism of what the chemistry that the brain needs in order to operate optimally. So there's an article in our website. If you go to akashacenter.com, there's an area that's called blog. And if you hit on that, you'll see a battery of tests that we've run for the last 20 years. And the most recent ones are the ones on NAD, on PC, and other innovative products that we see, or supplements that we see, are making a difference out there. So I would say, if you want to know more about it, I know that our incredible Luana, who also helps us posting all those articles, is online. She can post a link to these two articles that we're talking about. The one is on the NAD, the Dr. Boston was referring to, and the second one on phosphatidylcholine, or PC, so that you can benefit from the writings that we've done.
Thank you, Dr. DeMello.
If no one has a question, I'll mention one thing I didn't mention yet. One really common kind of supplement recommendation that I make has to do with when someone has an upper respiratory tract infection. So if they have COVID, or they have a cold, or they have the flu, how can they support their immune system temporarily while they're having that upper respiratory tract infection? So I typically have like a list that I go through, and I just keep these in my medicine cabinet for in case I get a cold. So vitamin C, like at least 1,000 milligrams a day. It can be in any form that you prefer. Like it can be that emergency packet. There's 1,000 milligrams in that. It can be gummies. It can be capsules. It can be however you want to do it. Then zinc. So you want it to be 10 to 20 milligrams of zinc, vitamin B12, and folate, or a B complex. And then if you're having pulmonary symptoms, so either a cough or congestion, you want to take N-acetylcysteine. It'll say on the bottle, capital N, capital A, capital C. And then it's just one 600 milligram capsule you take a day. And that helps decrease mucus production in the lungs.
I like Dr. Boston. I'm really in love with turmeric because of the incredible research on it as an anti-inflammatory. And so as winter is around the corner, the cold season, one of the things that we've seen is that turmeric, which is quite present in the Indian diet, has incredible metabolic properties, and most of them being anti-inflammatory. So if you can tolerate turmeric, that would be one of the recommendations that I would add to Dr. Boston's list. And at Akasha, we have a product that we've really formulated for a number of years called Infla-Regulator, meaning how do we regulate inflammation? And turmeric is one of the top products that I think should be on most people's regimen for upper respiratory or any other kind of inflammatory condition.
That's a really good point. And there's also a supplement called L-lysine, which has a pretty strong antiviral action. So I always if I think what I have, if the cold that I have is viral based, I always add in lysine, like 1 to 2,000 milligrams a day, just to help, kick that virus out.
Do we have more questions from
I
Ava?
have a question. Yes.
Go
Hi,
ahead.
Dr. Boston.
Hi.
You mentioned like pill forms of supplements, gummies, and I know there's like liquid form. Is there one best way that you think is the most absorbent way to get these supplements?
It kind of depends on the supplement. So a lot of people have trouble absorbing vitamin B12 from their stomach lining. And so for those people, I'd rather them do it under their tongue, like they call it a lozenge, even though it really just says chewable on the bottle. But you let it dissolve like under your tongue and it absorbs through the blood vessels under your tongue. And then, so if you're not, and of course you'll be swallowing the remnant, so you will get some in your stomach. But if you have a problem absorbing it from your stomach, like let's just say you're taking it on a regular basis, but your blood panel shows your B12 is still low, then you're not absorbing it from your stomach, and it's better to maybe do it under the tongue. In general, I prefer capsules. It's just easy. There's no added sugar. Most liquid vitamins don't taste great. So I'd say capsules is my go-to unless I need them to absorb it under their tongue, in which case it would be a chewable / lozenge. Or if someone's having canker sores in their mouth, I have them take a chewable probiotic, because at that point you really need the acidophilus like on the mucosa of the mouth, like not a capsule. Vast majority, I'd say it's capsule.
Very good.
Question, Dr. Boston. Can berberine help with diabetes and blood sugar levels?
It can be supportive in that aspect. Berberine can help with that. Some studies have even shown it helps with weight loss. So berberine is a supplement that can be tried to see if it can help support, a healthy blood sugar. It's not going to reverse eating a bunch of donuts, but if you're having an issue with insulin resistance, berberine can be another supportive supplement.
I don't have any questions, only to say, Dr. Boston, your presentation is incredibly helpful. And
Thanks,
you
Dr. DeMello.
you hit all the topics, and you delivered so palpably easy to understand. So I wanted to say thank you. And just to add another piece to the question about inflammation, because again, winter is right around the corner, we wrote a booklet called What's the Big Deal About COVID Supplements at the beginning of the pandemic. And even though COVID is not a big deal anymore, thank goodness, it's still out there. That particular booklet applies to every inflammatory condition that you may be experiencing. Certainly discuss it with your doctor, Dr. Boston said, to make sure that you're not going into pneumonia or any other, more serious inflammatory conditions. But if you're dealing with a common cold or the flu, and you've already been to your physician or any practitioner, and you want to know a little bit more about how to supplement your anti-inflammatory cabinet, so to speak, that booklet has a lot of the explanation of every product, including the amazing vitamin C that Dr. Boston is such a fan of, and so am I. So again, Luana can put that on the link to that booklet on the notes, but it's something that I find myself sending to my patients when they're dealing with upper respiratory or any other kind of inflammation.
Thank you, Dr. DeMello. Any final words, Dr. Boston?
There's so many different supplements that can help support your health. So it's really important just to, talk to your doctor. There's so many things I didn't cover. Like I take little iodine drops because my thyroid is kind of borderline, and it used to be our salt supply had iodine in it, and now it's hard to find salt that has iodine in it. And so I take these little drops to make sure I'm getting iodine for my thyroid. So, there's all sorts of there's so many supplements out there. You definitely don't want to be taking everything. If you're taking 20 or more supplements a day, that you are taking too many, most likely. You want to talk to someone about what do you really need and when do you need it, and what are the good brands. It's been very nice talking to everyone. I'm so happy to be part of the Akasha Center team. We're so happy to be here to support everyone's health. Everything I've said today is not meant to be taken as medical advice for your own medical care. I'd be happy to see you as a patient in a real medical visit if you want like actual medical advice.
Thank you, Dr. Boston. And if you have any other questions, please feel free to reach out to Anna Rivi, our office manager. You may also email us at info@akashacenter.com, or you may call us at 310-451-8880. Thank you so much for participating tonight. We look forward to seeing you and welcoming you at Akasha.
Bye.